Working for you. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts Nevis government. Join host Roy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for You is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for You.
Good afternoon, and I welcome you to Working for You. Thank you very much for tuning in to today's program. I wish to apologize for the late start. It had to do with things totally beyond my control. Wherever you are very welcome from week to week to join us on this program to receive information about what is happening within the government in St. Kitts and Nevis, information that is timely, relevant, information that is accurate and beneficial to you, the people of St. Kitts and Nevis, and of course further afield. Today we are going to be discussing something that is extremely important to our development, our national development, our regional development, our international development, and so on, and that is the importance of our health. And I have with me Dr. James Hospitalis, who is the Executive Director of CARPHA. CARPHA is the Caribbean Public Health Agency, which we will hear more about its work and so on. And I also have with me Sharika Weaver, who is the marketing consultant for the upcoming CARPHA Health Research Conference. She is also consultant at Caribbean Event Planning. To both of you, welcome to this program.
Thank you.
Good. We'll jump right into the meat of things. Dr. Hospitalis, can you give the audience a brief background of who you are?
Thank you, and good afternoon, Mr. Williams. Good afternoon to all the viewers. Who am I? A human being from this planet. There's only one home we have. I'm a citizen of Trinidad and Tobago. I am a physician, a doctor, specializing in preventive medicine and public health. And I've spent most of my professional life focused on how to improve the health and well-being of people of the Caribbean, how to have a safer, healthier environment, and so on.
Okay.
Currently, I am the director of the Caribbean Public Health Agency, which is just 5 years old, and I'm very pleased and honored to be that first director.
Okay. Sharika.
Oh, I'm a fun-loving introvert, but I think more relevant to what we're discussing today, I am one of the consultants at Summit Caribbean Event Management. We aim to take care of persons through their process of putting together any type of event, be it corporate or personal.
Okay. Good. Thank you so much.
Of course.
Dr. Hospitalis, who is CARPHA? When was it founded? What are its priorities and benefits? What are its vision and mission? Could you tell us?
Whoa, that's a long list.
Yes.
Well, CARPHA, or the Caribbean Public Health Agency, at CARPHA I have a little song that I sing, which my secretary invented. She said, CARPHA is yours, CARPHA is mine. A feeling of health is so divine. So let's hear the partners sing Money for the Caribbean. CARPHA is yours, sir, and CARPHA is mine.
Yes.
That's one of the first points I want to make. It is the newest public health agency in the world. Actually, that's not quite true. The new Africa CDC started in January of this year. It is a merger of 5 former institutions, regional health institutions, some of which were brand names. CAREC, the Caribbean Epidemiology Center in Trinidad, the Caribbean Food and Nutrition Institute, CFNI, in Jamaica, the Caribbean Health Research Council, which is the longest arm of CARPHA, over 60 years, and the Caribbean Environmental Health Institute in the OECS in St. Lucia, and the Caribbean Drug Testing Laboratory in Jamaica. So the heads of government in 2011 signed an agreement, the CARICOM heads, including the Prime Minister of St. Kitts and Nevis, who at the time and still is the lead Prime Minister for Health and Human Development in CARICOM. They signed into existence this new joined up public health agency. So it is an integrated platform of human and environmental health that brings together the knowledge, the skills, and creates a more synergistic approach to monitoring. You asked me what is the mission and the vision and so on. And the vision is healthy people in healthy spaces.
Yes.
Healthy people in healthy spaces. And you can unpack that and what it means. The mission is to improve health by working with the countries, working with partners to put on programs of training, of research, of education, informing the public, and developing and advocating for policy that will improve health, prevent disease, protect health. So that's our core mission and business. I think the heads of government were wise to create the institution. It's a very good platform for bringing together things, creating more, well, synergy is a big word, but get more bang for the buck. Definitely. It's always how do you consolidate things that different agencies are doing that have similarities to get a more impact. And that's what the agency is about. I have the honor and privilege to be the first executive director. Some of the priorities, well, we serve 24 countries in this region, which vary from Haiti with 10 million people to, say, Montserrat. Half the countries are around 100,000 or less. So you're talking small member states. And therefore, we provide that backup, the laboratory service, we provide the rapid response, we provide advice to some of the priorities in the region. Still, there are some infectious disease threats, especially with our tourism-dependent economies. We have to keep ourselves free of measles and polio. We have to watch out for the dengue and the chikungunya and the Zika and all these things. HIV, we're seeing the end of it, but you can't take your eye off the ball, so to speak. Then the big threat, though, these days is non-communicable diseases, and our big priority for hypertension, diabetes, how to change the food environment to get healthier food, especially for children and vulnerable populations. Climate and health is a big overarching threat for us in this region. We're more prone to disasters. You have these same diseases we're worried about. The vectors that transmit them, like Zika and chikungunya and dengue, are climate-sensitive vectors, which is as climate changes and global warming takes place, they multiply faster. The cycles are shorter, so you increase the risk of disease transmission with this sort of situation. Violence and injuries, and some aspect, mental health, significant priorities for the region as well. So there you have some big problems that the region faces.
I suppose we'll expound on some of those in more detail as I ask you some questions. But what is the hierarchical structure of CARPHA, the agency?
I'm the executive director. I report to a board comprising 3 ministers of health, 3 permanent secretaries, and 3 chief medical officers. The Pan American Health Organization and CARICOM. They in turn report to the Council of Human and Social Development and the heads of government.
That is COSOD.
That's the COSOD. That is the overarching, the major policy-making body for the region as a whole. So they would give impetus to a cooperation program in health that runs for 5 to 10 years, in which you focus attention and resources on shared problems that we have in the region.
Sure. Okay. Now, what importance does CARPHA give to scientific research and training?
CARPHA places a very high premium on scientific research and training. It is among our core functions in public health. And given our island states, you have continuous migration of people. So you have to have continuous training. And we complement the academic university type of training by being very much more applied. That's the essential feature of our training is much more grounded and applied. So you'll teach a doctor and make sure he or she knows how to fill in a certificate of cause of death properly. So we have proper statistics.
Right.
Practical things like the laboratories, how you investigate an epidemic, how you make sure you have food safety on the food line, how you actually package and transport specimens safely under international standards, because we're in islands and the specimens are coming down to our reference lab in CARPHA. So that gives you a little granular flavor.
And of course, if you would have conducted a conference on research for 62 years continually, they must be doing
That tells
an
you.
excellent job in maintaining the fabric of the work that they do.
One of my concerns is that we actually need to increase the investment and attention to research. We sometimes think research, we're too small. That is for bigger countries and bigger institutions. And I submit that is not so. I've seen in some of our countries, Turks and Caicos Islands, where we had the conference 2 years ago, the Ministry of Health research unit there putting out very pertinent data that allows the government to make better policy, that allows programs to be better evaluated, or can shed light on problems that they didn't know they had before. So I would say we actually need to invest more in our research to solve our problems in the region, not to ignore outside, but not to be overly dependent on information from outside, because often the context here is different, and you have to take account of our context and our culture.
So you don't think enough is being done in the member states, of course, of CARPHA, where research and training is concerned?
Research in particular is behind. The training part of it also is, as I said, it's a continuous need, but we are underinvested in both of those areas, so to speak.
Okay. Now, how is CARPHA funded?
We're funded by, the budget is just short of $10 million a year, US, and about half of that comes from the member states by quota contributions, and a little bit from the Pan American Health Organization, and then the other half comes from external donors, the US CDC, the Inter-American Development Bank, the European Union is a major donor, and so on. So the budget is, in round figures, let's say 10 million, half is from the governments and half is from external sources.
So do you think that you're adequately funded?
No, absolutely not. And of course, most heads of agencies would say so. I can argue why that is so and why an increased investment would improve the health and the economic situation of our Caribbean people.
Okay. Now, annually, you have a conference.
Yes.
And of course, it focuses on different things. And there's an upcoming health research conference that will take place in St. Kitts. Now, we want to hear some things about it. For example, the theme that was chosen, the dates, the participation, the registration, the aims, and the objectives of the conference.
Well,
Sharika.
well, how about I speak a
You-
little bit?
Yeah, sure.
So, when the conferences are put together for the CARPHA annual event, it takes into consideration a number of things, and they go well beyond things that most people would normally consider. So, to the general public, the event begins on the 14th of June. However, prior to that start for the general public, the CMOs or the chief medical officers of the region, they have their meetings, their communication meetings. There are special planning meetings that are taking place. So even as early as the 11th of June, you would notice that there would be quite a large contingent who would be here and who would be working assiduously to make all of the preparations or make decisions for upcoming policies and movements within the region.
Sure.
So the work begins before the work. Okay? And then we are hoping that with St. Kitts given the opportunity to host this year, I think the last time we hosted, was it 2005?
Last time St. Kitts and Nevis hosted was 2005 or 2006, somewhere
Yes.
around there.
So a while ago, more than a decade ago, and so we've been given the privilege of hosting, and we're taking it really seriously. We want to ensure that first the general public understands the magnitude of the benefits that they may derive from not just having it here, but from being able to attend. Very often, these high-level regional and international conferences, they do not open their doors to every and anyone who is willing to register and just meet the requirements, the very basic requirements, and in this instance, it's simply to pay your contribution. But in this instance, anybody could come. It's really open. Anybody could come. It is just for someone to follow through and register, and they can do that even as we're speaking this afternoon. Registration is already open. For those of you who do not have your pens and paper nearby, we want you to grab some, because very soon we'll be sharing with you the site that you can go to do your registration. So anybody could register. And then we must understand that 300 individuals will be flying into our federation to attend. You know the cost of leaving St. Kitts and Nevis. So we are already privileged because we do not have those costs. We're simply taking a shower, putting on something appropriate, and we're going over to the event site, which is the St. Kitts Marriott Resort. And then we are privileged because in Ireland we are being given special rates. We're given rates that are less than what some other persons have to contribute. And there is the additional privilege. There's so many privileges, and sometimes we take them for granted. There's the additional privilege of students getting even further reduced rates, because we want to encourage you to attend. And again, a little bit later, we'll let you know what those rates are. And yet, more consideration was made. So if you can't come from the 14th to the 16th, I think that's a Thursday, a Friday, and a Saturday. If you can't make all three of those days, then you could opt to purchase your space just for one day. You can go to the website, you can look at the offerings on the 3 days, and you can say, oh, this is really interesting for me, and select that date and register just for that date. So there are a number of opportunities, and we really want persons to be aware of them and to take full advantage of them. So go and grab the papers and pen. A little bit later we will give you that information.
Right, so the dates are June 14th to 16th.
Yes.
The venue is the St. Kitts Marriott Resort.
Yes.
And the theme is...
Theme
yeah.
is sustainable health systems for economic development and wealth. Sustainable health systems for economic development and wealth.
Sustainable
Health systems.
for economic growth,
For economic growth,
development,
development and wealth.
and wealth.
And what viewers or listeners may be wondering, what does sustainable health system and universal health have to do with economic growth and development? Well, health is a resource for living and working and loving, and if you don't have it in sufficient quantities, you're not at your best as an individual, as a family, and so on. So the connection between a healthy workforce and productivity is very much there, especially for the situation that we have these days. And so where the economy is struggling to grow and where you have a lot of costly and preventable health problems, if you can attend to those, you will improve your chances for economic growth. You will reduce some of your costs to families, to employers, and to the government. And that's why we've made this link between health systems and universal coverage, growth and development and wealth.
What are five tangible outcomes that you would like to see coming out of this conference?
The first and most and biggest outcome is as a result of what's called the public good that having this conference here is. It's a regional and it's a global public good. It's knowledge, new knowledge, to learn and study and reflect on how this applies to us, how can we use it. So the second, I would say, is that people get training and acquire new skills. We run training and data analysis, training not on this conference, but in others, on ethics, on how you design, how you present, etc. The third thing would be policy support. So there'll be a policy dialogue during the meeting, especially in respect of climate and the environmental things that we have to deal with. Government officials and ministers are participating in that will pick up ideas that will allow them to address and shape policy here in St. Kitts and Nevis. We will have people who are going to make new connections and possibly get new lines of funding for their work in St. Kitts and Nevis or in the region, because you'll have a lot of international partners attending. So we hope to see some partnerships catalyzed, and there's a Partners in Health Research meeting on the Wednesday the 13th to help bring together international researchers with our folk and help make sure too that what is being done is going to be aligned with our needs, and folks are not just parachuting in. So this kind of platform helps to bring people together. So a number of benefits there: knowledge transfer, skills development, policy stimulation, links to new lines of funding. Those are some, quite apart from fun. Oh, I forgot about that. Did I forget about fun? People are going to have fun as well.
Yeah, that's
You're St. Kitts, you must have fun, right?
Of course.
In addition, there are individuals in our community who work in the health sector or in the adjoining sectors who would benefit greatly, and it would impact the work that they do. I think it was yesterday during our media briefing, Minister Phipps, I think it was, shared that our nurses have a responsibility to offer each year information that confirms that they've been doing further studies and paying attention to what is taking place in the field of medicine. And that's important because we don't want practitioners or nurses or any form of health technical person who may have studied several decades ago but haven't looked at a book since to be working with our loved ones who are not feeling well. And the conference is going to create an atmosphere to provide the continuing medical education credits that these nurses and other practitioners need to get their registration process completed. So they can now in 2018 get that done for 2019 at minimal cost and over a period of 3 days. And really schedule themselves so that that is taken full advantage of. Then we have our students at the Clarence Fitzroy Bryant College and other universities throughout the Federation who could take advantage of the rich research interactions that's going to be taking place. If you have to do your thesis very soon, if you have to put together papers in the medical field, or if you're hoping to go off to university to study in these areas, it would be to your advantage to go and look at the research posters that would be on display. You'd be getting first-hand information from some of the region's top researchers as to how they're arriving at the topics, how they're doing their research, the kind of outcomes they're having, and that impacts our students as they study, and it impacts businesses. It tells you what you need to be spending your money on, what you're investing in, so that you're on the cutting edge of what's taking place for your business. So there's a lot taking place.
Sure. Now, CARPHA, back to CARPHA, the expert on CARPHA, Dr. Hospitalis. CARPHA rationalizes public health arrangements with what you call Caribbean Regional Health Institutes. What are some of them? And could you tell us their function?
You mean the regional health institutes?
Yes.
So that rationalization I touched on earlier, whereby 5 institutions were merged into CARPHA. So that was CAREC, the Epidemiology Center, that kept track of diseases and investigated new threats and ran the coordinated laboratory services. The other was, as I mentioned, the Environmental Health Institute in St. Lucia. So they work a lot, especially with Germany. They work with UNEP, United Nations Environment Program, focusing on monitoring water quality, water safety planning, and what we call integrated management of the environment and human health. They have quite a bit of work in supporting the hotel and tourism industry with water safety testing. The other entity was the Health Research Council, that for 63 years now has had this conference, which is merged into CARPHA, and a research council determines the priorities for the region, helps to provide funding, and does make sure things are conducted in an ethical manner, etc. The Food and Nutrition Institute, CFNI, keep it hot, keep it covered, keep it cold, was one of their jingles from years ago. Very important in monitoring the quality of food we eat, helping to work on government policy, training, and public education and research into the food that we're eating and our nutrition. So those were the 5, the Pharmaceutical Quality Lab in Jamaica, those were the 5 that were merged, rationalized into one.
Right. Okay.
We in turn work closely with other CARICOM institutions. So for example, what they call the Security Cluster, CARPHA is part of that. So that includes SEDIMA, it includes the RSS, the Regional Security Service, and it includes IMPACS, which is the Crime and Security Agency. That is a newer agency, so many people maybe are not so aware, but that is, again, at a regional level, providing very important services. For example, scrubbing all the passenger manifests of people coming in and out of the region for persons of interest against lists that Interpol and others would put forward. So you have us now in working more closely with other institutions, or CARDI on agriculture, how do we get healthier food, or CROSS-Q, the standards and nutrition quality, standards and quality folk, to get mandatory nutritional labeling of food for consumers in the region. So you find that in order to, it's not just running health services or preventing disease, but how do you protect health and promote health? You have to link up with other actors in society, civil society, private companies also, to create better conditions for healthier people.
Now, what are some of the major health challenges in the region, and how is CARPHA involved in tackling them?
The major health challenges of the region, the overarching major health challenge is, as I mentioned earlier, the non-communicable diseases, the huge problems we have with hypertension, diabetes, weight, pressure, sugar, smoking in this region. This is costing the countries anywhere between 4, 5, 6% of their gross domestic product, based on studies in several of the countries. We can't afford that. We can't afford that. That's what I would say. That's the overarching number one priority. Given our tourism-dependent economies, though, if you have to say what's number two, it's the health threats that we have to this region, and that you have to be on the ball with threats of infectious diseases, especially related to the climate changes that we're experiencing. A third priority would be around the need to pay attention to the health services, and that they're strong, that they're properly set up so people have access, especially the most vulnerable, poor people, women and children and so on. Those, having good preventive measures, good strong health service, two of the how does CARPHA figure in all of this? Well, our key job is to monitor health and to use that information and the determinants of health and the risks to help develop policy, advocate with the governments to put in place programs, education, training, services, and so on, and then monitor again that health has improved. And we also provide direct services such as the laboratory services that provide a diagnostic testing and keep the region free of diseases. So monitoring, research, training to be able to attend to these problems, though that's the role of the agency. Those are public health functions.
Now you mentioned earlier that HIV transmission was on the decline. What do you think is responsible for this within the region?
Well, for many years, the Caribbean countries have cooperated and tried and focused on HIV in a collective way through CARPHA, through the Pan-Caribbean Partnership for AIDS, and that has seen first the people became very aware of it. The blood supply was made safe by regular testing of good quality. Mothers who were infected were brought onto treatment, so this transmission to their babies stopped. And many of the countries of the Caribbean are now in process of certifying the elimination of that, what is called vertical transmission from mother to child. So that still leaves sexual transmission. But the good news is that if people get onto treatment and they stay on treatment, they practically have a normal life and they don't transmit the virus, or transmission is greatly reduced. So in that scenario, over the last 20, 30 years now, we've been facing this. We can see that deaths have greatly declined as people have gone on to treatment, that the spread, the incidence through the blood supply and through mother to child is way down. And now we're starting to think of, well, we can end this now. We can get everybody who's infected tested, onto treatment, non-stigmatize them, and get on with the rest of the problems we have to deal with. We're almost on top of this one. At least that's how I see it, having been involved in the fight 30 years ago. I think another 10 years and we've got this one beat.
Okay, now CARPHA is making, of course, certain conclusions, declarations, and so on. How do you go about gathering your data and statistics to be able to come up with these findings?
That's a very good question, and there are a number of strategic intelligence systems here for health in the region. First of all, you have the ongoing weekly or 24-hour reports from the countries on an agreed set of diseases and health conditions. There's weekly reporting, there's monthly, quarterly, annual. For example, every year the countries tell us they will provide the information on the causes of death, and that information is validated and cleaned and scrubbed, and those statistics are passed on to the Pan American Health Organization on behalf of all the countries in the region. So that's a constant thing that we're doing, the monitoring and responding, using that information to respond.
What about data and publication?
Right, so you're right. So beside the ongoing surveillance systems, and there are about a dozen different surveillance systems in the region, some of that we operate extend beyond just the CARICOM countries to bring in Central America. So for example, for polio, measles, and rubella, if persons are suspected in those countries of having it, those specimens eventually make their way quite quickly to our labs in Port of Spain. The other would be to look at your research database and to look at what is coming in terms of new evidence on how to do things. And a third would be to monitor the programs that people have already committed to. How are we progressing with those? What are and so the research is not so much what needs to be done, but what are the barriers to the uptake? What is the political feasibility of this thing? How much is the cost? Where is the money going to come from to do this? And those are the kinds of research now that we want to be giving more emphasis to actually focus on implementation. We have pretty good ideas of what can be done that will improve health and economic prospects in fairly short time. Just to focus on getting those done.
Yes.
What about cancer research? What has been done in that area?
Well, after cardiovascular disease, cancer is the number two problem of the region, or the number one problem of the region, and it is growing because our populations are aging. It is growing because of obesity. It is growing because we still have people smoking stupidly, and those are some of the risks that we have in the region. The research that we have done shows that the death rate from colon cancer, breast, and cervix in our region is 2 to 9 times higher than North America or say Puerto Rico. And so that makes you go, well, why? Why is that so? Is it that there's a high incidence to begin with? Do people present very late because they're afraid? Are the services not available for treating either medicine or radiotherapy? So this kind of research helps to spark more questions and digging into what's going on and looking at what are the barriers and breaking it down to see how we can improve it. We are concerned that some of the more effective medicines for cancer are very expensive. So they work, but they cost a lot. And some of our countries have a hard time affording those. We would like to see convened a meeting of manufacturers for the region to say, what are the essential cancer medicines? How much do these cost now? And suppose we all pool together, work through the PAHO revolving fund and the PPS in St. Lucia. How can we bring these costs down so people who need it, children who need it, have access? And that kind of dialogue is where the regional approach is beneficial to individual small countries. You get the power of numbers.
Now, of course, CARPHA can't do it alone. If you could speak to some of your partnerships and linkages that, make all of this happen for the agency.
The number one partnership that makes this happen for the agency is the link with member states. The chief medical officers, the chief technical officers, the ministers, those are our Class A shareholders, the number one partners in the endeavor. And they provide about half of the funding. So we're a good return because we leverage that and get another as much again. The major partners would then be within the region, the CARICOM Secretariat itself, and the Assistant Secretary General for Human and Social, and the Pan American Health Organization. Those are two core partners. PAHO is an international development partner that's part of the WHO and global. Among the funding partners that are very significant to us would be the U.S. Centers for Disease Control, or the CDC, the United Kingdom Public Health England, and the Public Health Agency of Canada. We also receive some support from Japan, from Germany, quite a lot of support from the European Union, the Inter-American Development Bank, the World Bank. Now, why are some of these countries so interested in working with us is a good question. And when you think about it, they actually have real estate in the Caribbean. They have people and assets here. There are 236 cruise ships in the Caribbean working last year, carrying 27 million passengers, 40% of whom were North American, and people coming from Europe, people coming from Brazil. So you start to see a different complexion to the whole thing when you put it like that.
Now, part of your role, of course, is strengthening health systems. How would you rate the health system in the region? If I had to tell you, rate it on a scale of 1 to 10, how would you rate it? What are some of its weaknesses and strengths? And what would you say are some of the pillars for a good regional health system?
For a good regional health system, if we look at, say, the WHO PAHO pillars of what makes a good system, you must have something that we specialize in, information. to make decisions, to guide and monitor and evaluate. You must have funding, the financing mechanism, and how you're financing this, from taxation, from NIS, from and this is something where all the countries are struggling with, especially as population expectations grows and technology availability grows and the costs go up. So information, money, you must have trained human resources. And therein lies a challenge with our small countries. It's a perennial challenge of having appropriately trained people available to provide quality care. Service delivery is another pillar. And again, with our very small countries, take cancer, you only have a few places that have up-to-date modern chemotherapy and radiotherapy within the region. So you must have arrangements intra-regionally for early screening, diagnosis, and then transfer and referral. So the other place has to have places where the family will stay, etc., etc. And that is still not sufficiently worked out in the region. And we actually have some places that say we have extra capacity for treating cancer. And you have countries that have people dying unnecessarily because they can't get to treatment in time.
Right.
So how you actually deliver service would be a fourth pillar. The whole issue of governance and how you structure your health services. One of the strengths about our health systems in the Caribbean is a long history of primary health care and publicly provided care. Those are good public policy approaches. The mix has changed over time as more and more healthcare, especially adult ambulatory care, is delivered by private GPs. And how you hold such people accountable, how the information from them is meshed into the national picture, quality of care, etc., etc. The health systems approaches that we need to take these days need to be adjusted and nuanced with our realities in mind. We're so small that everybody can't, and people may not like to say this, everybody can't have everything that you may say you need. You have to share it. You have to have regional provision, and that's a more cost-effective way of if the arrangements work out. So those are some of the pillars. Rating overall.
Now, now, in some of the member states, for example, there are certain things that are very crucial. How many countries or member states have oncology units? How many are equipped with adequate dialysis machines, for example, MRI, and things like that? Because sometimes what happens is that the travel cost associated with healthcare is phenomenal. People have to leave their home countries and to travel elsewhere, whether within the region or outside of the region, to be able to get access to, treatment, because we don't have either the equipment or the plant for such treatment.
Mm-hmm. That's so it's important to realize what you just said and have a good mapping of what are some of the needs and where are things available, and look at how we can optimize. I'm saying we're not even there yet. We have overall needs, but we have services and capacities that we don't even make full use of. So there's still scope for putting heads together and doing better with what we have.
We have to do the best with what we have.
We have to do the best with what we have, yes.
Okay. Now, what are some of the ongoing programs and present initiatives of CARPHA?
Some of our ongoing programs have been commenting on the laboratory monitoring. Among the new initiatives that are we really value are the tourism and health program that works with the Caribbean Hotel and Tourism Association and works with CTO, Caribbean Tourism Organization, to improve the quality and the competitiveness of the industry. And you may wonder, what is public health and tourism?
Yes.
Well, tourism is our lifeblood in this region overall, for most of the countries, and increasingly so. And it's an industry that's vulnerable to threats of disease or environmental threats and so on. So by having in place good systems of monitoring, good people who are trained, and you're able to rapidly respond, good systems of detection, then you can protect the industry and protect the investment and protect our image, and protect people, both residents and local. So that's one of our initiatives, the Tourism and Health Program, that has come up with some very innovative mechanisms, good not only for us, but good for other parts of the world. And the funding agent, the Inter-American Development Bank, has recognized this. They're excited about it. We hope to bring it to the OECS with funding from the Caribbean Development Bank. We're in the process of negotiating that. One I touched on earlier is the Caribbean Regulatory System for Pharmaceuticals, or the CRS, which is an initiative that aims to provide common registration for medicines right across the Caribbean, and a good process of due diligence. It's in partnership with the Pan American Health and funded by the Bill and Melinda Gates Foundation. And that is also looking very promising to be able to increase access to medicines for citizens, that they, safe medicines, good quality medicines, to bring down price for governments by bringing in more competition, and by making it easier for industry to be able to register right across CARICOM.
Sure. Sadly speaking, the Caribbean, as you are well aware, has a challenge in dealing with rising violent crime, gun-related, and so on. Has CARPHA engaged in any study in terms of crime and its impact on the regional health system?
To the extent within the resources that we have, we've done a little bit of work in this area. To first of all, I mentioned earlier that the causes of death of people in the population are reported to us every year. So you could make analyses of these to see what is the burden of violence and homicide on our populations. And you can say, and you can see, and you can say that if you look back over a period of years, you know, it appears as if several of these countries are experiencing epidemics of homicide. If you didn't have murder written and you just showed the graph, it would appear as if some epidemic is going on, because the problem has gone up so much in many territories over the last few years. It's complex phenomenon related, as you say, to the availability of guns, which are a very lethal vector of death and disease, so to speak. Back in the day, if some people, two men had a big bad disagreement and somebody takes a cutlass or pelts a stone, there's a good chance the other guy would survive. But a gun is a different story, especially these modern weapons. So the harmful use of alcohol is a contributor to all kinds of injuries, violence. Most times when you hear some serious thing going on and somebody chop up and shoot up and whatnot, alcohol has played a role. So we need to pay attention to that, harmful use of alcohol, gender dimensions and helping with gender sensitization training, conflict management training. In Jamaica, I saw an interesting program where they're able to quickly get teachers to stop beating the children by teaching them how to manage a difficult child without resorting to violence. So that's like a vaccine, if we could get that, if we could get people to have an argument without chopping or, you know. So we also have, in terms of the medicines, Sharika is just mentioning something to me, we have a program whereby people can report suspected counterfeit or problems with medicines. You can report it online on the website.
Vigicarib.
It's called Vigicarib, yes.
Yeah.
Being vigilant about the quality of our medicines in the region.
What about your 6-point policy package for healthy diets? I was doing some research.
We'll save one of the best ones for last then. The 6-point policy package on healthier food environments is a comprehensive, evidence-informed suite of policies that we have validated internationally, and that the CARICOM, Council of Trade and Economic Development, have taken on board as being something to really pay attention to. What are the 6 points? They are, first of all, mandatory nutritional labeling of food processed in this region and intended for consumption. So people will know if a food is high in salt or sugar or fat or overall calories. The second is the standards and guidelines for the schools, so we have healthier schools. The third is around reducing the bombardment of marketing to children. That's unethical, the amount of bombardment. The fourth is around what you call product reformulation, to work with manufacturers to reduce the levels of harmful ingredients, salt, fat, sugar, and overall calorie levels. The fifth is around trade measures and fiscal measures. Fiscal means like taxing
Yes.
sugary beverages, such as Barbados has done, and other countries have done. And trade measures would be to use the trading policy regime that we have to indicate to the outside partners, we are trying to have healthier children, and we would like you to adhere to these conditions when you're supplying us things. And there is a procedure for doing that, and the Office of Trade Negotiation would be the one to lead on that, to consult with the. And then the sixth of those pillars of the 6-point policy package is food chain incentives, particularly for fruits and vegetables. And to see, and the CARDI, the Caribbean Agricultural Research Development Institute, has the lead to see how we can look at our agriculture policy, look at other things that we're doing to
Yes.
improve access, especially for the vulnerable population. So those are the 6 points in that 6-point policy package. And as I said, the Council of Trade and Economic Development of CARICOM has taken it on board. We will have quite a big joint meeting between the health ministers of the region and the trade and economic ministers in July to look at this subject in particular.
Now, there's quite a move within the Caribbean. Every so often, the discussion surfaces about the decriminalization of marijuana. What impact do you think that the decriminalization of marijuana can have on the Caribbean public health system?
Okay. Well, I'm on record speaking about the public health impacts of public health dimensions of decriminalization and legalization of marijuana. And from a public health point of view, this I've summarized it as saying, proceed with an abundance of caution. There have been many times in history where people, populations, societies have gone very liberal with substances of abuse. The Americans are in the middle of a big opioid crisis, and many decades ago they had a huge problem with addiction, especially among white women. So we in the Caribbean have a problem with marijuana and clogging up of the courts and the justice system, and that's understandable to try and reduce that side of it. I think, though, in introducing those kinds of public policies, consideration has to be given to the full range of impact. Because we don't want that, okay, you solve the problem, so to speak, of reducing the burden in the judicial system and the prisons and so on, and you create a great surge in increases in mental health admissions for marijuana addiction and other addictions. What I think needs to happen is that there should be strong public education concomitant with decriminalization if governments proceed along that route. There needs to be proper monitoring of the impact of these policies. I'm seeing in some of the countries that have gone that way reports from the chief medical officers that they are indeed seeing major increases in admissions of mental health problems associated with marijuana psychosis and increased use. So you have to look at the whole thing when making a public policy decision.
Now, what is the impact? Because we are seeing quite a number of or younger persons involved in the use of marijuana. What is the study saying? What is the research saying about young people and their use of marijuana?
The research shows that a significant percentage of young people in the Caribbean actually already use marijuana, even if it's only infrequently. In some cases, more than report that they use tobacco or cigarettes. The harmful consequences of this are well documented to mental health, to social interactions, to occupational opportunities. It is not good for your studies, in short, if you're a young person, a student. It's very bad for your studies. And it tends to demotivate a lot of young people who, I think most Caribbean people are aware of others around us in our families or among friends who have not achieved their potential because they've been smoking weed most of their lives, to be plain, or they have a problem with it. So we do see significant medical harm social and occupational harm that say you should take this thing seriously and not be too free with it. And there needs to be a proper regulation of the use of a substance like that.
Okay.
Persons with curiosities around both sides of the argument may really want to commit to being at the conference, registering, because then you get the opportunity to push the conversation and get information on both ends, or to speak with researchers and try to convince them to do further research, because we've seen persons who shared documents that they are using to probably say maybe we need to consider it. So I think no matter what your opinion is on the matter, it would be beneficial for you to be in attendance at the conference so that we could have it looked at on the research end there.
Okay, fine. We are going to go to the phone lines. Of course, this is a call-in program, and we are going to take some calls. I have with me Dr. James Hospitalis, who is the Executive Director of the Caribbean Public Health Agency, known as CARPHA. And I have with me, of course, Sharika Weaver, who is a marketing consultant for the upcoming CARPHA Health Research Conference, which takes place here in St. Kitts from the 14th to the 16th of June at the St. Kitts Marriott. The numbers to call are 465-2555. That's the local number, 465-2555. And the overseas number is 1-718-577-2916. That is 1-718-577-2916. We welcome your calls.
Roy? Hello? Are you hearing me?
Yes, I'm hearing you. Working for you. Good afternoon.
Good afternoon to you, Lesroy. Someone that I dearly loved.
Thank you.
And good afternoon to you, very special, important guests. They couldn't come at a time more important than this, Lesroy. Because the gentleman mentioned something about impasse, and he said, much people might not know about it, and he's absolutely right. You remember, Lesroy, I told you to go and check it out? It's an organization within CARICOM that deals with law enforcement. It was just last week you had some people as your guest, and I said to you, Lesroy, national security is much more than what they are saying to you. For example, the gentleman here is speaking about diseases. What if, Lesroy, we are being impacted by some sort of disease, that there's an outbreak? CARPHA is going to come into play. And so when you look at impasse, there must be a part of the national security apparatus. There has to be a part of it. And so I will only hope, Lesroy, when the government look at a policy, they look at the laws of the country, because a policy cannot supersede the law. And include public health, port health, agriculture. All those agencies must be a part of our national security apparatus. And whoever the gentleman is, I am so happy that he mentioned impasse, because people here don't know about it, and the government is not telling people about it. There's no one who ever come and tell us what it's all about. Have a good day.
Thank you. There is no one on the line at the moment.
Good afternoon.
Oh, there is someone on the line. Working for you. Good afternoon.
Good afternoon, Brother Lazari.
Good afternoon, sir.
And good afternoon to the good export them get some CARPHA, trying to uplight us and update us on our health issue.
Good afternoon.
Lazari, I want to commend you. I believe that you asked all the questions then for the whole federation. You really asked some hard questions, And to be truthful, I want to commend you, and I want to commend the people, the men from CARPHA, to answer the questions then, because this is where we want to highlight about our health system and all those things. And I believe that is a way forward to go with these people. I like the gentleman said that the eight thing are down, and I just want CARPHA and other organizations to just carry out the duty and try to update us on our health issue all over the whole of the Caribbean, because this is something that's very important to us. Because something, the obese again, our health, the kind of food we eat. You find these fatty people, these young girls getting fat and big and hairy. We got a lot of them in the federation, and I want CARPHA to just let me know what in that them food now that they eating that's getting them so overweight. You all have a wonderful day. God bless.
Thank you. Working for you, good afternoon. Sorry, there is no one on the line. Oh, we lost that caller. Dr. Hospitalis, do you care to respond to our callers in any way?
Thanks, Will. On the first caller about the issue of impacts, the Implementation Agency for Crime and Security, that is an important entity indeed that has been increasing its relevance and function. So they convene regularly, the commissioners of police and chiefs of security. And we now talk about health security, ports of entry, your capacity in your hospital for containing a problem, air transport. We don't have regional health security if we can't reliably move a specimen or a patient or a quick reaction team to help you. The ability to communicate, and both to our own residents, so that they are not frightened, and to communicate with the external markets, so that again you don't lose unnecessarily a clientele. So this health security idea, I take the gentleman's point. When we look at violence, and we were talking about that earlier, and what are the risks for it, we have been talking to impacts that we have a mandate for prevention that could be combined with the crime and security, and we're talking. The second comment about the thanks for the feedback. Yes, the AIDS issue is a little bit down, but if I could speak in a Caribbean way, that don't mean you could pull out the gun and fire it everywhere. You have to continue with your precautions, pad up and protect yourself, etc. Everything that has been taught for the last years remains valid. Just because the problem is going down, you don't let up your guard. On the food that we eat, yes, this is a big concern. We're seeing young children, boys and girls, changing in front of our eyes. Not like we used to be. So that is a big public health concern, and it is a lot about the food we eat, the calorie content. The sugary beverages, one of those sodas is 140 calories. One or two of those a day, and you don't change anything else, that's 10 pounds at the end of the year. And you can see after 5 or 6 years what has happened. You've crept up 40 to 50 pounds by drinking 1 or 2 sweet drinks every day.
You know, there has been a lot of focus placed on the consumers. What focus is being placed on the producers?
Very good question. Very good question. And I think that's where the producers, the consumers, governments, and academics and people like us need to sit and talk and say, look, we have a problem, folks. And everybody has a role in this. Producers have a role, we are saying in our 6-point policy package, to reduce the level of harmful ingredients in food that they're making now. Levels of salt, fat, sugar, and overall calorie content. For consumers, one of the easiest ways to reduce overall calorie content is to get smaller plates. Get a tape measure, go in your kitchen and measure the size of your plate. You probably find it's 12 or 13 inches. But if you go with what your grandmother used to have, well, like when I was first married, our plates are 9.5 inches. And that is the standard size of a dinner plate up until about 25, 30 years ago. And then it changed.
Do producers just have a role, or they have an ethical responsibility?
If we don't purchase it, they will stop doing that. So it's a cycle, but we can do something to assist the producers in making the best decisions for us.
Business in a way has only one ethical responsibility: make money. That is their raison d'être. Hopefully, it is done in a way you don't have, you have fairness, you have etc. etc. But that is the raison d'être of business.
Sure.
So, do they have an ethical? I think they do. Especially, no one company is setting out, I don't believe, to harm children, but it is the collective impact of the whole environment that is causing what the gentleman rang in and said we are seeing, and what is going on. So that everyone needs to talk about that. If you have school teachers that are saying to the children, I don't want you sweaty in my class, so the child doesn't want to walk or doesn't want to play, everybody has a responsibility in this problem.
Now, speaking about ethics and ethical responsibility, I didn't hear much of that on this program, which I would invite you to share on now in terms of CARPHA and how CARPHA pitches for, of course, professional medical ethics within the region.
Thank you.
We have a caller. Working for you, good afternoon.
Good afternoon. I was hoping that CARPHA would talk about environmental situation like schools, the building, because I'm now hearing things this place have mold and that have mold. And I was wondering if CARPHA wasn't involved in the Basti High School situation.
Okay, thank you. Right.
Well, just to quickly go back to the ethics issue, then tackle the environment. We place a high premium on ethics, especially research being conducted ethically. So we do training in ethics. There's a research ethics network for the Caribbean, where we also have a committee that is Caribbean-wide, and member states can send in research proposals. So you make sure they're of a good quality. One of the things that was a surprise to me as a citizen of the region was to realize through our work 2 years ago that no country in CARICOM really had legislation governing human subjects research. In that situation, all countries are more vulnerable to people who might conduct research that is not ethical, whether they're from the region or outside of the region. And so we have embarked on, with the Caribbean Law Institutes.
Sorry to interrupt, but could you define human subjects research for those who are listening? What are some examples?
Human subject research would be where you are involving people in gaining information to be able to make a generalization about the problem or how to be more effective or what is a better treatment and so on. So
Stem cells research
would be included. Yes,
genetic engineering.
Yes, those would be included in human subject research. So if you're checking out a new vaccine or you're testing the effectiveness of a medicine, even as simple as if you're conducting a questionnaire survey of students, for example, about private matters, that is human subject research. It is not invasive, and so the ethical considerations are not as significant as if you're going to give somebody a medicine or use a surgical treatment or other innovative treatment. All of these fall under human subjects research, and so they ought to be in our region in 2018. We should be making progress to have legislation governing human subject research that protects people, that defines rights, that defines informed consent, etc., etc.
Is that something CARPHA is making a pitch for?
Yes, and we have
working with the heads of government, the member states.
Working with the member states, working in particular with the University of West Indies Caribbean Law Institute Center. And last year we had a meeting to work on model legislation that all CARICOM countries could tap into.
Okay, now environmental health issues. The caller raised that, of course, we're hearing sometimes of buildings having molds and people getting, people getting sick at work and all of that sort of a thing. In schools and other places, where people congregate. Could you speak to CARPHA's, pitch for environmental healthy surroundings and how the environment can impact on one's health?
The you asked me at the beginning of the program about what is CARPHA or the vision, and I said about healthy people and healthy spaces. So implicit in that is that the environment is super important to our health. The water we drink, the food we eat, the air we breathe, the conditions under which we, and Minister Hamilton was talking about this yesterday at the press meeting, under which we live, learn, work, play, and pray. Those are all the conditions around us that make for life. So the conditions under which we work or live or learn is typically in a building. And so you have issues around indoor closed air space to manage. We're in the tropics, it's moist. Mold is common. So if we put a dish in this room right now and take it to the laboratory, by tomorrow morning you're growing mold.
Yes.
So we all have mold in the air all the time in the Caribbean. The problem is when you have poor ventilation or the levels of it go very high, and then you may have to identify that, take remedial measures to avoid those kinds of exposure. But environment is obviously a fundamental determinant of health. If we have environments to shift slightly that you have only roads and cars roaring along, who's going to walk or ride? That environment's hostile to health. And so the caller is right that air quality and indoor air quality is important. What we do at CARPHA is we do have a certain amount of capacity, and we do help, upon request, we will help with the consultancies around teasing out some of these problems. Sometimes it's not easy to tease out what is really the cause of an outbreak of symptoms in a particular building or establishment.
Okay, fine. Now, we're almost out of time, but you've said quite a mouthful, Dr. Hospitalis, and of course, Ms. Weaver. But what I want to know is what have been some of your successes in the region as a public health agency? You've spoken a lot about your challenges and so on. What have been some of your successes?
I think some of the successes have been for the first 5 years of the agency, the anchor that we provide to the disease elimination programs of this region that WHO, PAHO have recommended, and that is going all the time. Citizens are not aware that health security backroom is operating every week. And we have done that for all of the 5 years. I think the second thing I would pick in terms of achievements is the successful response to the epidemics of chikungunya in 2014 and the epidemic of Zika in 2016. We are still seeing the after effects of that epidemic and are in process of setting up the studies to follow the babies that were born in that Zika associated period. So that would be a second success, the successful facing of these epidemics. If I have to pick a third area, I would say the creation of new partnerships to tackle problems. So the problem with the hotel and tourism industry, where they are our lifeblood, but they are vulnerable, we have partnered with them to create a tourism and health program. And that is innovation that the region needs and the world needs. I say that's a success. The early success we're seeing with the registration system for pharmaceuticals, that's very promising. The 6-point policy package on the healthier food environments, let me tell you, I count it a success that we have the trade and economy sector in serious discussion about how their policies can improve health or the other way around. And that is progress, to have significant, serious discussion between social sector institutions, health, UE, and so on, and the economy sector, agriculture, trade. How do we fix some of these problems in our society? So I picked those as some examples of successes. I could go on, but
yeah, sure. I know you can. What are some of the some ways in which you think the Caribbean public health system can improve?
The first, perhaps most important, is to understand that public health is perhaps a little different from health services delivery. It involves thinking about the health of the whole country, or a whole population, a whole village, a whole community, and the determinants of health: education, water, nutrition, transportation, agriculture. But when those things are in place, you have a healthy population. And if some of those are not in place, you have sickness and cost that is unnecessary and that we can't afford.
True.
So that's trying to paint a picture there.
Okay. Now, Sharika, before we leave, could you refresh us about the upcoming CARPHA Health Research Conference?
Well, we did promise you earlier some information, so by now I think everybody's equipped to write. We're going to be sharing with you the costs to attend if you're going for 1 day, if you are going for the 3 days, and the special rates for our students. In addition, CARPHA has been so gracious. They have provided several corporate tiers of packages for companies or businesses or entrepreneurs who wish to sponsor or advertise for this regional, even international conference. And so we're also going to provide information as to how you may become a corporate sponsor. Additionally, there is the opportunity for our persons who have really key areas where they want to interact and network and show their products and probably even sell some products to secure an exhibition booth throughout the 3 days. So that information is going to be given first, and then I'll give you the registration information. So if you're wishing to gain a corporate sponsorship, and we're touching bases with persons, but you don't have to wait for us to touch base with you. You may go to Summit's website and follow the link, put your information there, and we will contact you. The website is summitcaribbeanevents.com. Summit is SUMMIT, caribbeanevents.com, and we will take care of all of the arrangements and the registration as you get your corporate packages and your exhibition booth. As you are aware, Marriott has very limited spaces for exhibition booths, so we really invite you to make contact very, very quickly. You may also call 869-660-9697. That's 869-660-9697. Let's start off with our students who are coming. Once you can show proof that you're a student, a registered student, whether that's your student ID or any other form of information, and you are wishing to come just for 1 day, if you're coming on the 14th or the 15th, you pay $80. And if you're coming on the 16th, you pay $60. Those prices are for 1 day attendance. It does not include the awards banquet, which is going to be one of the premier events for this conference. But if you are wishing to get yourself all dolled up and to attend and to bear witness to those persons who are receiving awards, predominantly in the area of research. I think there's a Young Researchers Award and several others. And I think maybe back in 2012 we had an award recipient from St. Kitts and Nevis. So if you are wanting an enjoyable evening, you can also secure your award banquet ticket for $125. Then there are persons who are in the health arena, maybe a nurse or a doctor or some other form of medical technician who is seeking to gain their continuous medical hour credits through this program, which we spoke about earlier, you can secure your entire package, and the cost that you pay will be determined by how quickly you go and secure your package. So if you are a student and you are coming, you are getting a student rate of $150 US if you purchase this by May 14th. After that date, you are paying late fee, and it's $175 US. However, when you compare that to the regular price that is being offered, you're really getting a steal of a deal. So students, please take it seriously.
Okay.
And then we have the general early bird registration for all of the days. It includes all of your meals, your refreshments. It includes the awards dinner, and kitchens and divisions are getting a special rate of $475 US. If you are early again, and if you're late, you're paying $550 US. So we really need you to get moving. Go to the CARPHA's website, which is conference.carpha.org. That's conference.carpha, CARPHA.org, and you can do your registration there.
Okay. Thank you. Dr. Hospitalis, 2 quick words before we go. 3 or maybe 4, but not more than that.
Your health is your wealth. Invest,
Okay.
invest in it, protect it, keep it.
Okay.
People often don't value it until they lose it.
Okay. Thank you so much for being on today's program.
Pleasure, sir.
It has been a pleasure, Dr. Hospitalis and Sherika Weaver.
Thank
Dr. Hospitalis is the Executive Director of the Caribbean Public Health Agency, known as CARPHA. Quite a tremendous responsibility he has indeed. And Sherika Weaver, who is a marketing consultant for the upcoming Health Research Conference put on by CARPHA in St. Kitts at the St. Kitts Marriott Resort and Royal Beach Casino from June 14th to 16th this year. Make sure that you register and be a part of it. I want to thank all of our callers and all of our listeners to today's program. We appreciate you every week. This has been another edition of Working for You. We are going to see you next week. I am your host, Lesroy Williams. Until then, have a good time. Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.